All right. Thank you very much for joining me this evening. My name is Dr. Paul Stanislaw. I am a facial plastic surgeon in Avon, Connecticut. I have been board certified for almost 22 years now. Tonight's topic is all about chemical peels. There is a lot of confusion about chemical peels, so we're going to go over all of them and try to explain them and tell you what they do and what they don't do. To start off with, chemical peels come in a spectrum of treatments. They can be as simple as a glycolic acid that you do yourself at home, and maybe in the morning and the evening, to a medical grade physician strength chemical peel where you have a downtime of about 7 to 10 days of walking around with Vaseline on your face. So before we go into all of the different types of chemical peels, we're going to start with a little bit of basic science before we start. So when it comes to the skin, there's two major proteins in the skin. There's collagen and there's elastin. Collagen is the protein that gives your skin thickness. It gives it toughness. The example that I give is that if you're looking for a couch and looking at swatches of leather for that couch, that swatch of leather, it's thick, it's tough. It does not stretch at all. That's all collagen. As long as you're healthy, you continue to make collagen throughout your life. You cut yourself, you heal by collagen deposition. When we do a chemical peel, or a microdermabrasion, or a microneedling, or a laser resurfacing, they all are doing the same thing. They're all causing controlled injuries to the skin, and those controlled injuries are stimulating the fibroblasts to lay down collagen in the skin, and it causes the fibroblasts, the skin cells, to pull on the collagen. So a chemical peel is actually shrink wrapping the skin. It's tightening the skin through this injury. So if you did a glycolic peel at night, it's a really, really tiny injury, very low risk, very low downtime. It might sting for a few seconds, but that's about it. A physician strength chemical peel, it's a deeper injury, it's a stronger injury, it's going to be more powerful, but with that power comes a longer downtime and theoretically increased risks because it's going deeper. Now, collagen deposition and healing is something that when we do this, we're trying to help with fine lines and fine wrinkles. It's shrink wrapping the skin container. It's not going to take care of deep smile lines. It's not going to take care of deep marionette lines or deep furrows. It's more for the fine lines, and we're going to get more into that in a second. So besides collagen, there is the protein elastin. Now, this is a completely separate type of protein. I'm going to switch to I hope this works. I'm going to switch to my fancy AV whiteboard. I don't know. Well, can you see it? I'm not sure. So we're going to talk about elastin and how it's different than collagen. Elastin protein, when you're born, 4% of your skin's elastin protein. After you're born, it never goes up. You're not going to grow it. There's no fancy laser that's going to make you elastic. There's no fancy cream that's going to make you elastic. And essentially, you hold on to elasticity for a genetically determined amount. So I am going to go to my whiteboard. You're probably not going to see my face, but that's probably okay. So when you're born, 4% of your skin is elastin protein, and you're going to go on and hold on to it. It's tough to do it backwards. And then at a certain given age, it's going to drop off, okay? And everyone at that point, they all come in and say, yeah, I was doing really well up to this past year, and this past year it all went to hell. All of a sudden, I look in the mirror, and all these wrinkles are showing up. So essentially, this is your rubber band. Think of your skin as a rubber band, and your rubber band is hanging on, and finally it breaks or it stretches out where it can't compensate anymore. And once that happens, it all sorts of drops down, so it's pretty precipitous. Now, we all age differently. Some people age better. They hold on to their elasticity for longer. And then we know people who age really poorly and they lose their elasticity earlier. Now, overlay all the sun damage that you get. So say this is me, right? And this is, at this point, all the sun damage, all the UV light that I've gotten over the course of my lifetime is going to shift this curve in. It's shifting this like this. Okay. So the most cost-effective thing to slow down the aging process, okay, this is not very fancy or technical, is a good quality sunblock, a medical grade sunblock with zinc oxide in it. Zinc oxide is, in my mind, my personal opinion, the safest ingredient of sunblocks. It blocks both UVA and UVB. The only other ingredient that blocks UVA and UVB is avobenzone. I'm not going to really go into it, but I'm not really a fan of that. I like zinc oxide products. And you should just buy the medical grade ones because they go on clear, they don't give you pimples, and they're going to cost more than something you get at Walmart because they're micronized. They go on clear, and the process to micronize it is patented, so it's a little bit more expensive. So the most cost-effective thing to slow down the rate at which you're going to age is wearing a good quality sunblock with zinc oxide every day. So that takes care of this. Now, say we are 40 and we start topical retin A, topical vitamin C, and topical vitamin E. Now, those things do not grow elastin. What they're doing is they're acting as antioxidants and they're making you hold on to your elasticity for longer. So if you started when you're 40, what is it going to do? Those things are going to shift this curve out. It will not grow it. Now, say you start this when you're 50. It's going to shift this curve out, but you'll never catch up if you started it earlier. So retin A is probably the stronger of the three antioxidants. It's going to make your skin red, flaky, and peely. And if you ask me what the two most cost-effective thing is to slow down the aging process, it would be a good quality sunblock and zinc oxide. Vitamin C and E are the other two antioxidants that are in topical form. Those two are usually together. They have to be in an anhydrous preparation, meaning there can't be any water in them. So the vitamin C and the vitamin E are usually together in a serum, which is an oil, or an anhydrous paste. So it's a dry paste with no water in it. If there's water in it, the product oxidizes quicker, it breaks down faster, doesn't have as long of a shelf life. Also, the one important trick with vitamin C and E's, and this goes for all acids, so if it's salicylic acid, other things, you want to make sure that your skin is always dry, completely dry before you apply these things. Because if you apply the vitamin C, which is ascorbic acid, or salicylic acid to your skin, or glycolic acid, and your skin is wet, that water is just going to neutralize that, it's going to dilute and neutralize that acid. So when I'm talking to people, I'm trying to make a difference between collagen and elastin. So a chemical peel does not make you elastic again. Nothing's going to make you elastic again. And you'll notice I'll never say anti-aging. There are no creams that are anti-aging. There's nothing that's going to stop you from aging. All we can do is try to slow down the aging process, hold on to your elastin as long as we can. So I usually tell people vitamin C and E, and vitamin A. I like to do all three of those because I like to work on all the antioxidant pathways than just hammering just one. So you could just do retin A, dry, flaky, irritated. But if you're using all three, you're sort of working on all of those pathways, and that helps maintain your elasticity for longer. Also helps with collagen too, but that's the major proteins, elastin and collagen. Now, to sort of drive the point home with the difference between elastin and collagen, let's say I do a facelift on somebody and I lift up their skin and I trim out all the extra skin, all right? I am not making them elastic. I am taking a stretched out slinky or a broken rubber band and I'm trimming out the extra that's there. Okay, so I'm tightening the stretched out slinky, but I'm not making a new slinky. Those patients will come back, come back in 6 months, like, you know what, it's great, doc. My jawline's good, my jaw's better, my marionette line's better, my neck is great, I'm super happy. But you know what, when I do this and I bunch down like this still bunches up like this. Well, I haven't made that skin elastic. I've tightened it, but I haven't made it elastic. So that's how I sort of make the example of the difference between collagen and elastin. So chemical peels, again, they will stimulate the fibroblasts to lay down collagen. It's the contraction of that collagen by those fibroblasts that shrink wraps its skin. It is really the healing process that helps with the skin. Now, if I did a full-strength chemical peel, I'll tell people, well, it's causing that injury, and you can still see improvement up to 3 months after that full-strength medical-grade peel, because the healing just doesn't stop at a week or 7 days or 10 days. It's going to continue for several months. So I tell people it takes up 3 months to see the final end product. If you're doing something like a glycolic peel at home, a salicylic acid peel at home, what are you doing? You're causing these little tiny injuries that are stacked over time, and they're helping with that process of maintaining the collagen and thickening the skin. But it's just a process that's ongoing, it's continuous. Now, in that spectrum, you have your own products that you can use at home. Then you have things that you would go to the esthetician for. So if you have a medical grade esthetician and you go to see them, you could have an enzyme peel, you could have a glycolic peel, a lactic acid peel, a salicylic peel. So that's a strength up. So in that spectrum, it's sort of the next strength up. Then there's, from a chemical peel standpoint, then there's a physician strength chemical peels. Now these can vary too. So I could do a physician strength chemical peel where you're red and peely for like 3 or 4 days. I can do a stronger one, which is now 7 days of downtime. When I do chemical peels, I do a medium depth peel. That's as deep as I go. I don't go any deeper. The reason being is because if you start going deeper than a medium depth peel, you run into a much longer downtime. So now you might be 2 weeks of putting Vaseline on your face. I will tell you, in today's day and age with work and all the other pressures of life, no one will give me 2 weeks for a downtime. I am really lucky to get that 7 to 10 days. The other thing is, the deeper you go, the more risk of complications. So if you have, so a long time ago, down in the South, a phenol chemical peel was very popular. Phenol peel is a deep chemical peel. The phenol was melanocytic toxic. Fancy term for saying the phenol killed the pigment cells. So down south, phenol peels were very, very popular, and it made their skin whiter. The reason that it was popular, again, this is a long time ago, was because it showed that you weren't out working in the fields, you were inside the house, and you weren't getting a lot of sun. Those chemical peels are really fallen out of favor. Not many people do them. They do have a much longer downtime. Nobody wants their skin to, at least that I deal with, wants their skin whiter. They want their skin to be more natural in appearance. So I don't do the deep peels. I only do the medium depth peels. Now, for patient selection, it depends on what the color of your skin is. So we have something that's called a Fitzpatrick scale. Fitzpatrick scale is sort of grading how fair someone is and how dark their skin is, and it ranges from 1 to 6. And you could be of Northern European descent, have very, very, very fair skin. You're going to be a Fitzpatrick 1. You're going to get sunburns really easily. And then you could be a really, really, really have dark skin from African descent and really, really dark. Now, the average American, the average, I guess, Caucasian, I should say, is like a Fitzpatrick 3. I would consider myself a Fitzpatrick 3. Someone who has darker skin, maybe Latino or Asian, they might be a Fitzpatrick 4, and then so on, it goes up. When you're doing chemical peels, if you have darker skin color, you cannot really do the more aggressive chemical peels. If you're a darker skinned individual and you do a stronger chemical peel, you have higher risk of hyperpigmentation or blotchy brown skin, and you have higher risk of hypopigmentation, whiter skin. Now, if someone has darker hyperpigmentation or darker blotchy skin after the chemical peel, that will fade over time, but oftentimes we can give them bleaching agents, like medical grade bleaching agents, creams for the skin, and that will lighten it up and it'll make it go faster. If you make someone's skin whiter, okay, hypopigmented, that's permanent. There's no bringing that back, and all you have is makeup. So when you have someone who has darker skin, it sort of takes away a lot of those treatments away. Darker skinned individuals can do the acids themselves, the medical grade skincare products with the acids in them at home. They can do stuff with estheticians. They can do glycolic peels, lactic acid peels, enzyme peels. But when you start going into the stronger ones, when I start talking about downtime of like 7 days, you sort of can't do those. So it really depends on how dark your skin is. The other thing is, if you're doing something like, say you've taken Accutane in the recent past, you can't do Retin-A, or not Retin-A. You can't do a chemical peel if you're doing Accutane. People have different ways of approaching Accutane. I was always taught, if you've been on Accutane, I really can't do anything to your skin for a whole year. Some people are a little bit more aggressive. They'll do it at 6 months. I think it goes case by case, but when I do it, I can't do anything strong to someone who's been on Accutane for a year because the skin doesn't heal well afterwards. Any other, so just trying to think any other contraindications or anything like that. So chemical peels, if I'm doing a physician strength chemical peel with a downtime, what are we treating? If someone has fine lines, okay, fine lines out here, you can use a chemical peel. So again, it's going to shrink wrap that skin, it's going to tighten it, and it's going to smooth it out. If people have hyperpigmentation or brown spots, they've got brown spots all over their cheeks or on their forehead, the sun damage, right? You can treat them with a chemical peel and that will help them. If you have precancerous spots, so some precancerous spots, so actinic keratosis, and I'm not going to go into it, but these are kind of the red, flaky spots from sun damage, not cancerous, not close to cancerous, but very early actinic keratosis. You can treat that with a chemical peel. And what is that chemical peel doing? It's sort of taking the precancerous skin that's on the surface of the skin, it's sort of pickling that, and it is killing those precancerous cells. So we can treat really sun-damaged skin with that. So those are really the indications for doing a physician-strength chemical peel. Now, not every brown spot should be or can be treated with a chemical peel or a laser for that matter, because a lot of times people will come in and will have, brown spots all over, and we have to look at them. We have to decide, the physician has to decide, well, are these benign brown spots? Do I have to worry about these? Could these turn into something later, like a melanoma? Is it a dysplastic lesion or is it a melanoma? So be very careful when you're doing skin resurfacing procedures for brown spots. I know that there's a lot of non-core providers, and when I say non-core, core is dermatologists, facial plastic surgeons, general plastic surgeons. If you're getting brown spots treated, you want to make sure that your skin's been checked by one of those core physicians to make sure that it's not something that we have to worry about. Unfortunately, I see a lot of people who have had brown spots treated on their face, and they've had it lasered, they've had it chemical peeled, and then they come to me and I look at it like, oh my God, that looks kind of not so good. And I have to biopsy that and send that to the lab and see what that is. And the problem is that when you treat these brown spots, so say they have a large brown spot, it looks kind of funky, and they've treated it with a chemical peel or a laser, not only does it change the gross appearance of the brown spot, which makes it harder to diagnose what's going on, but it also changes the microscopic appearance of it. And when the pathologist looks at the slide, at the biopsy, they're going to say, yeah, there's something going on here. I can't tell what it is, and I can't rule out an early melanoma in situ. Once they say that, that brown spot has to be treated like a melanoma. You can't just say, well, it's not sure. So if you've got a brown spot, like one big brown spot, and particularly right here, in this area. This is like, I've seen so many patients where they've had one big brown spot here, no other brown spot, just a big brown spot there, and they'll come to me and say, oh, I want to treat that. That often turns out to be something not so good. So if you have like one brown spot that just doesn't match everything else, it's kind of large, it has irregular borders, irregular colors, you really, really want to have that checked out by a dermatologist, preferably a dermatologist, so that they can look at it and tell you if that's something that has to be biopsied. Now, sometimes these brown spots will look kind of benign, or they'll look benign. They're round, they're homogeneous, but they're kind of big. They're just very unique. They doesn't match other ones. The thing about those is that they may look benign now, but they can change over time. They can undergo genetic changes that could lead to a dysplastic or a precancerous lesion or a melanoma. So there are some lesions that, yeah, they look fine right now, but I will not treat them because it will make it more difficult to follow that lesion over time. So in those situations when I have a patient who has a brown spot that, yeah, it looks fine right now, but I am worried about it, I will not chemical peel that. I will not laser treat that. I won't even give them bleaching creams. I will refer them to a dermatologist and make sure that that spot is followed over time, because you can biopsy it today and it's perfectly fine. 5 years from now, they biopsy it and it's changed. So be wary about treating brown spots. Make sure that whoever's doing it is really a core physician and they have the knowledge to say, you know what, we shouldn't treat this. And unfortunately today, a lot of people just treat, and just because they don't care of, well, I shouldn't say that, but you know, they're really not cognizant of the potential ramifications of treating a brown spot down the road. Now, when we do esthetician stuff, right? So we're doing like glycolics, we're doing the mild chemical peels, the mild creams at home, the lactic acids, the salicylic acids. You can do those to the neck, you can do those to the face. The face is a much more robust skin. It has more sebaceous activity, it has more hair follicles. You can treat the face more aggressively with your treatments. The neck, however, is very thin, doesn't have the same sebaceous activity, doesn't have the same hair follicles in there. This is very delicate. The chest is very delicate. So you can't go aggressive on the neck and on the chest. So when it comes to the neck and the chest, you can do your own creams at home. You can do salicylic glycolic lactic acid. You can do your vitamin C. You can do your vitamin E. You can do your retin A. You can do things with your esthetician. You can do microdermabrasions. You can do chemical peels, enzyme peels, all like esthetician grade stuff. You can do down here, and the face. But when it comes to the stronger chemical peels, like a medium depth chemical peel where you're having a downtime, you really have to stop at the jawline. So I can do the full face, I do up to the hairline, I do all the way out to the ear, I do under the eyes, I do the nose, I do the upper lip, but I have to stop and feather it right at the jawline because the if you go down here, this can scar, okay? So stronger chemical peels only from here up. So that's the areas that you can treat. When I treat these, I'll generally treat the whole face, but there are times when I won't treat the whole face. So there are times when people just have wrinkles under the eyes, okay? They just have, not dynamic wrinkles. So if you've got wrinkles that are only there when you smile, crow's feet when you smile, that's treated with Botox or Dysport. Over time, those wrinkles will become embedded, and what I call those static wrinkles that are embedded in the skin. Whether you scrunch or not, there's these lines. As we get older, this skin under our eyes gets thinner, it loses elasticity, and when we smile, it pushes up. Instead of it contracting like a rubber band, it bunches up like an accordion. So when I have really wrinkly skin, very thin skin through here, I have the crow's feet, I will treat that with a medium depth chemical peel. It's done in the office. It is very elegant. It works very, very well. This skin is very delicate. you can predict. Chemical peels are very forgiving. You can tell how deep you're going, and they're very, very nice for under the eyes. So a lot of times I'll just do a subunit. So I'll do under the eyes, or I'll do periorally around the mouth from the smile line. So if someone's got a lot of wrinkles here, I'll go through here and go through here, but a subunit. When you're doing resurfacing procedures, you always want to treat in subunits. So just the cheek subunit, periorally, under the eyes, forehead. So because it makes it blend easier. So sometimes you'll just treat subunit, and then you'll treat the whole face, okay, depending on what the skin is doing. Sometimes we'll spot treat though. So sometimes people will have a couple brown spots on their cheek. Sometimes they will have a little precancerous spot on their cheek or their forehead, and I'll just spot treat that with a chemical peel. So I'll just treat the one spot, and that's it. They'll put Vaseline on for the week. It'll be a little pink, but generally heals up very, very well. So depending on what's going on, depending on if I just have one little spot or a couple little spots, I can spot treat. If I have a whole face with little fine lines and wrinkles, or a lot of sun damage, or I have someone who's got so much sun damage that if I only treat one spot, there's going to be a discrepancy. It's going to be, well, why is this area good and this area is not? So, like for example, for under the eyes, if I just treat under the eyes and the rest of the skin is got a lot of sun damage, a lot of fine lines, a lot of little pigmentation, this is going to look beautiful, nice, smooth, nice, healthy, and pink, but there's going to be a line of demarcation where the rest of that skin looks wrinkly and brown and blotchy. So when that happens, you really sort of have to treat the whole face, but then there's value to it, right? If I've got lots of wrinkles and brown spots all over, then there's value to treat the whole face and to have that downtime. The downtime's the same whether I do one spot or the area, and we're going to get into the treatment, how long the treatment for that. There are times when people will come in, and this happens really quite often, where they've got great skin. They don't have a wrinkle, they don't have a brown spot, their skin is pristine. And they'll come and they'll ask me, well, I want to do a chemical peel. I want to do a chemical peel. And I look at them and I'm like, wow, your skin's really, really good. You don't have any wrinkles, you don't have any brown spots. I don't know how much value there is to do this at this point, because there is a downtime with a medium strength chemical peel. You're walking around with Vaseline on your face for 7 days. So sometimes those patients who come in and they're like, oh, I want to do this, and their skin's really, really good, I'm going to tell them, well, you're going to be better served by doing the retin A, doing the vitamin C, doing the vitamin E, doing the sunblock to slow down the aging process, because you're still doing very, very well. Sometime you might end up having doing the chemical peel. Or I might say you should see the esthetician and do microdermabrasions or do microneedling or do esthetician grade enzyme peels, because you're really not ready yet for a more aggressive chemical peel. The other thing that people come in often for is melasma. So melasma is, remember I talked about the brown spots that you can't treat? Melasma is one of the brown spots you really shouldn't treat. So melasma is the mask of pregnancy. It is a hormone-related hyperpigmentation of the face. It can occur up around the forehead, it can come around the cheeks, and it can occur over the white lips. So it can look like a mustache. It can look like brown blotches all through here or brown blotches through there. People often think that, oh, it's related to birth control. Not necessarily. Is it related to pregnancy? Not necessarily. So if someone's on birth control and they have melasma, then they'd want to stop. They have to decide if the birth control is more important than the melasma. But they can stop the birth control and sometimes they'll get better. If it's an issue with pregnancy, well, obviously that's much more important than the pigmentation. But sometimes that'll fade on its own. But sometimes people just have melasma, regardless if they're not pregnant, they're not on birth control. That's just the way they are. And sometimes that melasma can be so severe that even makeup can't cover it. And in that situation, see how long? Okay, so when people have that melasma, and when it's that severe, they'll come to me and they are like, well, I want to do something. I want to do a laser, or I want to do a chemical peel. The problem with melasma is that you can't beat melasma. There's no such thing as beating melasma. You have to be in the mindset of controlling the melasma and trying to suppress it. You'll never beat it. So the safest way to start for melasma is to start with topical medical creams, right? So hydroquinones, non-hydroquinone bleaching agents, sunblock. If you are not good about wearing your sunblock, and it's got to have the zinc oxide in it, no matter what you throw at that melasma, you will never, ever beat that. So sunblock is number one. You can't say I get tan and want to beat my melasma. So sunblock, hydroquinones, non-hydroquinones, alternating those things to try to suppress that melasma. Now, sometimes that doesn't work, right? So sometimes the melasma is really severe and it just doesn't. And again, I'm going to back up a little bit. To treat melasma, you can't just do hydroquinone by itself or a non-hydroquinone bleaching agent. You really have to do it in a combination of therapies. Doing the retin-A, do the hydroquinone, do a prep for your skin. So you're playing on synergisms between the retinoids and the bleaching agents and the sunblock and the acids, the salicylic acids and the lactic acids and the glycolic and the kojic acids to suppress the melasma. So it's not just, oh, here's this one, because people tell me all the time, oh, I did hydroquinone for 2 months. The doctor just gave me this tube. I did it. It didn't squat. Well, it's because no one educated you on how to do it. They didn't play on the synergisms. They didn't really address it in the correct way. Now, melasma is a funny thing too, because not only is it the sun, it can be heat induced. So if you live in a very hot environment, this summer's been hot everywhere, but heat in itself can bring out the melasma. Using a hairdryer up in your hair, that heat can make this melasma flare up. So not only is it sun, but it also can be heat induced. So if you're using a hairdryer and you've got a lot of melasma there, you're going to want to stop using a hairdryer. You're going to use it on cool because that can make it worse. If you laser melasma, if you IPL, intense pulse light, if you broadband light melasma, it will rebound back 5 weeks later and be worse than it was when it started. I cannot tell you how many times I've had patients come in and say, oh yeah, I had this IPL and like it just came back and it was even worse. You cannot, anything that's going to make it red, anything that's going to heat that melasma up, it's going to cause that melasma to rebound and be even darker later. So even chemical peels, I do not treat melasma with chemical peels because it can rebound, right? So, oh, it looks great right now. 5 weeks later, it's back with a vengeance. So I don't do that. I don't treat melasma with chemical peels. It's basically really topical stuff. Now, if you have melasma and it fails topical creams, there's a oral medication called tranexamic acid. It is a medication that's used for helping people clot. So if someone has really bad nosebleeds, if they have dysmenorrhea or very heavy menstrual periods, or you're having orthopedic surgery, we can give you tranexamic acid and it'll help clot your blood. You'll have less blood loss. Oddly enough, that medication helps with melasma. It suppresses melasma. So in people who really fail all the topical creams, they don't have risk factors for having blood clots, they're not smokers, they're not on birth control, you can put them on tranexamic acid or oral pill, and that actually can suppress that melasma. People also talk about microneedling tranexamic acid. So if you have melasma, you can put the tranexamic acid on top of that hyperpigmentation and microneedle it and try to get the tranexamic acid into that melasma to suppress that. So once again, chemical peels are not good for melasma. So chemical peels, if you're doing a physician strength chemical peel, it's best to prep your skin before doing a chemical peel because you will have a downtime. When I say prep the skin, the better you are with doing your sunblock. You can't be tan when I do a chemical peel. You can't get tan right after I do a chemical peel. So you have to be really, really good about wearing your sunblock with zinc oxide. The better you prep your skin before the chemical peel with retin A, topical vitamin C, topical vitamin E, those antioxidants, mild acids. Like we use a program called ZO, and that ZO program has it has all these ingredients that have been formulated to work synergistically, to work better than any one of them by themselves. And we will prep people's skin before they do the chemical peel. And by prepping the skin, it makes the downtime shorter. The skin recovers a lot quicker because it's all geared up. A lot of times when people start the ZO program, that topical program at home, it works so well that a lot of people will not go on to do the chemical peel. They're like, you know what? It's got my brown spots better. It's got my skin better. My skin glows better. It doesn't look all dead and sallow. So oftentimes people start that ZO program and they'll say, you know what? It's good enough. It's done a great job. I don't need to do the chemical peel. But there's going to be a percentage of people where it's not strong enough for them. They still have those brown spots. They still have that actinic damage. They still have the fine lines and wrinkles. And then they'll go and they'll do the chemical peel, but their skin will recover quicker. They won't peel so much and they will recover faster. That same prep program, we'll do that before the chemical peel. And then a month after the chemical peel, we'll restart that to make the results. So during that healing process, remember I said that a chemical peel will continue to heal, will continue to improve for up to 3 months. So at that 1 month time frame, we're going to start that prep program again to try to get as much healing as we can and get as good a result during the next 2 to 3 months. So you'll resume that program. The chemical peels, we do not do them in the summer months. We do them from October through April. The reason being is because, again, if you get sun, it doesn't play well with a chemical peel. If you're tan, it doesn't play well with a chemical peel. And the chemical peel has a downtime where you can't put sunblock on. So we'll start doing it in October and we'll do chemical peels all the way through the April. And then once May, June stops, we'll stop doing that. So we prep, we start in October. When you do a chemical peel, a full strength, like a medical grade medium depth chemical peel, we will consult with you first. So we go over everything, make sure you understand everything, go over all the treatment options. If you decide you want to do a chemical peel, you'll meet with Julia, our medical esthetician, and she will start you on that prep, which is included in the chemical peel. Then we'll see you 2 weeks before the chemical peel. At that time, we're going to give you your prescriptions, we're going to give you your instructions, we're going to give you your goodie bag with all your supplies, take your photographs, and have you sign the consents. The important thing that you need to know is that when you're doing a chemical peel, you have to take some medications for that. The risks with chemical peels is that it can give you a bacterial infection. So we're causing trauma to the skin, which could allow a bacteria to infect the skin. And so an hour before the chemical peel, you're going to start an oral antibiotic, and you're going to do that oral antibiotic for 1 week throughout the chemical peel. So we have to give you that prescription. The other prescription we have to give you is a prescription for chickenpox or shingles. It's called valacyclovir. You're going to start that 2 days before the chemical peel, and you're going to do that for 7 days after the chemical peel. The thing is when we do a chemical peel, the trauma of the chemical peel can trigger a shingles outbreak. So it can trigger a herpes cold sore outbreak, but also shingles in any part of your face. And so to prevent that, you have to do the valacyclovir 2 days before and 7 days after. So we give you those prescriptions at the 2-week pre-op. For the chemical peel, we do it in the office. You're wide awake for the chemical peel. There is no sedation. There's no IVs. We're going to give you, we do like someone to drive you there and drive you home though. So depending on the areas, if we're just doing under the eyes, I'll inject some numbing medication around here, sort of a ring block to help with it. If I'm doing a full face, I'll inject some numbing medication around the face to help with that. You want to wash your face beforehand. Know the day of the procedure. no makeup, no moisturizer, no sunblock, no nothing. You want to have your skin as just like the day you were born, nothing on there. We'll do the chemical peel. So if we're doing a subunit like periorally under the eyes, we'll just do that area. If we're doing the full face, we're going to do again from the jawline all the way to the hairline, everywhere except for the upper eyelids. Do under the eyes, forehead, nose, cheeks, so on. The procedure itself, if I'm doing a full face, takes about an hour and a half because we do subunit by subunit. And we'll start with the perioral area. So the first, we'll apply one acid. Okay, it's called Jesner solution. It's a combination of lactic acid, salicylic acid. It's just a combination of acids. It stings a little tiny bit, but we'll put it on a couple coats on here. Then we're going to do a 35% trichloroacetic acid peel, and then that goes on top of that. That one stings a little bit more, and that's what the numbing medication's for. When I apply that to that area, that skin is going to go through some color changes. It's going to turn white, and as it turns white, it's going to tell me when I can stop, when I should stop the chemical peel. So it's kind of like a color indicator to it. So I put it on there, I watch it turn color, and when it gets to the right color, white, I'll take sterile normal saline, just essentially salt water, like water, and I'll put it on there. It'll instantly neutralize the acid. There is a question about if someone has a history of cold sores, it doesn't stop you from having the chemical peel. Basically, you just have to start the antiviral. So you do the antiviral the 2 days before and for the full days, and it's not a contraindication. Even if you've had shingles, it's not a contraindication. You can still do the chemical peel. And then people ask me this question. I've had the shingles vaccine. Do I still have to do the antiviral? I just don't know of any studies that are out there that says the vaccine is going to protect you in this situation. So even if you had the shingles vaccine, I'm still going to have you do the antiviral. Not taking a chance. The antiviral is so incredibly safe. I've done a big research study with that antiviral many years ago where I gave people a huge dose and they tolerated it fine. The biggest side effect was a headache. So with the antiviral, so you're going to do that antiviral to prep. You're going to start that after. You need someone. You should probably have someone to drive you. Oh, so I'm going to turn you. It's going to turn white. I'm going to put water on it. Then I'm going to do the next subunit. Same drill. Do the next subunit, next subunit, next subunit. So I go subunit by subunit, and as it gets to the right color, I put water on. So it's really a lot of water. When I'm done, by the time I'm done, the skin goes from white to kind of reddish, okay? And we're going to put Aquaphor, or a fancy type of Vaseline, or sometimes just Vaseline, or even in my case, I use Crisco. You're going to put the Vaseline all over your face, every place it's done, and you're going to keep it coated on there. Afterwards, it doesn't hurt, right? So the chemical peel doesn't hurt afterwards. For me, when I've had 3 full face chemical peels, full strength, full chemical peels to myself, never hurt. What I did find that it made my skin kind of itchy. I didn't like the Aquaphor made my skin itchy, so I used Crisco, which is perfectly fine. So when you go home, you're gonna keep it lubed up with the Aquaphor. As time goes, the next couple days, it's going to get swollen. Every place where I treat it. So if I just under your eyes, it's going to get swollen. As if I do the whole face is going to get swollen. So what I tell people is that swelling is going to peak out between days 2 through 5. Okay. So you're going to keep the Vaseline everywhere. Everything's going to get swollen. The swelling is going to peak out really day 2, day 3. And by day 5, it starts to settle down. The skin is going to go from reddish to gray, like if you had a really bad sunburn. So if you had a bad sunburn on your back when you were a kid, after a couple days, the skin turns grayish, it peels off in sheets. And the skin underneath is pink. It looks exactly like that. The skin is going to peel off in little sheets, okay? And the underlying skin is pink. So days 3 through 5, it looks scary. You're swollen. The skin's grayish. All the brown spots are even darker now. They're going to pop. They're going to get darker. and it's going to start peeling off in sheets. Every time that I've done it to myself, days 3 through 5, I'm like, oh my God, what the heck have I done? It is, and I do this to people all the time, and even when I've done it 3 times myself, I still go through like, holy cows. But I will tell you what's incredibly amazing to me is how fast it makes the turn. By day 5, it's scary. Day 6, the swelling's going down. The skin's sort of peeled off a lot of it. Looks better. By day 7, the swelling's all down. The skin is pink. A lot of the gray skin's already peeled off, and it looks so much better. So it really makes a change very, very quickly, and it never ceases to amaze me how fast it makes that change and how fast it recovers. So usually you'll come back, so during that week, you're taking your antivirals, you're taking your antibiotic, Tylenol if you need it, but no one really needs anything. You're just keeping it coating all the time. You can't let the skin dry out. So if you don't put the Aquaphor on there, you let it dry out, it's going to be red for longer. If you peel off the skin before it's ready, it's going to be red for longer. If you scratch it, not even break skin, if you just scratch it, it's going to be red for longer. So everything we're doing is trying to get you to recover as quickly as we can. And all those things, scratching, peeling, drying out, is going to make you red for longer. You'll come back and see me in a week, and I'll look at your skin, I'll clean up the little parts and stuff, and I'll say, you know what, your skin's healed up enough, now you can stop the Aquaphor, the Vaseline kind of stuff, and now you can use Cetaphil lotion and use Cetaphil cleanser. So a mild cleanser, a mild soap, and a mild moisturizer. That skin is baby fresh at this point. You can't put makeup on it with preservatives in it. You can't put Retin-A on it. You can't put any acids on it. You can't put sunblock on it. Okay, so if you put your makeup on it that's got a preservative in it, and because this is baby fresh and you have an allergic reaction to that makeup, the ingredient in the makeup, your skin will get red and itchy, and it'll be red for months. So if people want to wear, because if the skin's pink and they want to wear makeup, they have to wear Jane Iredale makeup, which is a mineral-based makeup that has no preservatives in it, that is made specifically for resurfaced skin. That was the whole reason that that makeup was made a long, long time ago. So if we're going to do makeup, it has to be the Jane Iredale makeup, mineral-based with no preservatives for the first month. Then you come back and see me in a month, and in a month, I will tell you, all right, your skin's healed up enough. Now you can wear sunblock, you can resume your Retin-A, you can resume your prep kit from before, you can use your own makeup as much as you like, you can use your own cleansers and all that type of stuff. But for that first month, you really have to baby it. And that's why we don't do it during the summer months, because you can't go out and get sun during that 1 month period. I'll then see people back at 3 months. And at 3 months, again, it's because the healing doesn't just stop at a week, doesn't just stop at a month, right? It can continue for 3 months where we still continue to see that shrink wrapping, see that improvement. So I'll see people back at 3 months. Now, people will ask me, how long does this last? How long is this chemical peel going to last? It lasts a very, very long time, but that's kind of it's a loaded question because there's 2 different categories to this. So sometimes people will have really, really deep wrinkles, or they've got very fragile skin, very thin, very delicate skin, or they have darker skin where if they've got thin, delicate skin, I can't go as hard as I want to, or they've got really, really, really super deep wrinkles, and even if I go to the depth that I want to go, it's just not strong enough for the depth of for those people. So I will tell people, so say you've got really, really, really deep wrinkles, I'll be like, all right, I can only go so hard with the chemical peel before I scar you. I can't just go, I just can't crank it up and cook you, because then you'll have white hypopigmented skin, scar. So if someone's got really, really deep wrinkles, I'm gonna say, I'm gonna go as deep as I can at this point, and then we might have to do this again a year later, right? To stack it, to make it better over time. Or if someone has really delicate skin or darker skin where I don't feel like I can go very hard and I have to really dial it back, I'm gonna say, well, we're gonna dial it back, and we might have to do this again in a year, because I'm afraid if I go too hard, it's gonna hurt your skin. So those are two exceptions where I might say, we're going to do this in 6 months or a year again and have to redo it and stack it over time because I can't go hard enough. Now, say I get you really, really good and everything's good. Well, how long is that going to last? Well, again, it depends on your genetics. It depends on how you're going to hold on to your elasticity, which I can't control. Depends on how long you're going to hold on to the fat and bone mass in your face, because if you deflate, you're going to get wrinkly. It depends on how good you are with your sunblock. So if I do all this work and make your skin all good, and you go out and suntan and you don't wear your sunblock, well, guess what? That sun's going to continue to, the ultraviolet light's going to continue to break down your skin and the elastin, and you're going to still get wrinkly. So when you do this, okay, and you're taking on the downtime, you really are investing in your face, and you need to take care of it afterwards. So after we do that chemical peel, you really have to be good with your sunblock, good with your retin A, vitamin C and E, to maintain those results as long as you can. Because again, the chemical peel is not stopping you from aging. You're going to continue to age. Wrinkles are going to continue to come. But as a general rule, I will say that I've been doing this for 22 years. And in that 22 years, I have one woman who has really deep wrinkles under her eyes, and I'll do her lower lid chemical peel once a year, maybe every 2 years now, maybe every 3 years. But again, she's got very deep wrinkles, and we try to stack that over time. After that, I will say I have a handful of patients where I've done a chemical peel years ago, and I do a repeat chemical peel. So it lasts a very long time, and I can't, again, there's so many variables with it, I can't tell you, oh, it's 5 years, 10 years, but you can sort of figure it's about right in that range between 5 and 10 years. What else for chemical peels? Again, I've done 3 to myself. I've had a brown spot somewhere around here where I've spot treated that brown spot a couple times because it was kind of hard. I had to hit that a couple times and I got that better. I've done a full face chemical peel 3 times. Again, because I'm trying to keep this skin container as tight as I can. I can't do a facelift on myself. It's just not going to work, right? So I want to, as I lose bone mass in my face and I lose fat in my face, and as these wrinkles come, I want to try to keep this container. I wear my sunblock. I try to maintain my elasticity, but I'm going to do that chemical peel to try to shrink wrap it with time, over time, so that I can postpone having to do a facelift. I can sort of slow down that saggy process by shrink wrapping it. And I love chemical peels. Now, lasers, so in today's day and age, everyone's all about lasers. Oh, I want a laser to take my mole off. I want a laser to do this. Lasers are just a tool. I'm not going to go too much into lasers, but I'm going to give you a little brief history. In 1990s, the CO2 laser, someone invented a handpiece where the CO2 laser was able to take off the top layer of skin. So it used a computer-generated program, took off the top layer of skin. So the first pass burned off the top layer, and then the CO2 laser, you do a second pass, and that would heat up the collagen so much it would shrink wrap the skin. You could watch those wrinkles shrink wrap. The thing with the CO2 laser was, it was really revolutionary at the time, but after doing it for a whole bunch of years, you realize that it was kind of rough. It was so strong that the downtime was 2 weeks. It was Vaseline for 2 weeks. You had to clean it every hour on the hour. It was oozy, very, very strong, long downtime. The other thing was because it was so strong, you really had to go to sleep for it. You had to be asleep and have anesthesia because it hurt quite a bit. The other thing was that, like for areas like under the eyes where the skin was very thin, it was too strong and people could scar under there. And the last thing with the CO2 laser was that when you CO2 laser people's faces, they might look, again, really great at a month, really great at 6 months, good at a year. But if you follow those people out long enough, and I mean like 5 years later, about 20% of those people, their skin would turn whiter over time. So 5 years later, their skin would be whiter and it would be shinier and have a really weird characteristic. So people talk about, oh, when I'm down in Florida, I see all these people walking around, the skin looks really white and really stiff and really shiny. That's a CO2 laser, right? And so I don't do CO2 lasers anymore because A, no one's going to give me 2 weeks of downtime, right? Where you're looking like really swollen and stuff. And B, even in a lily white person, I can make them whiter with a CO2 laser 20% of the time. And that's 1 out of 5. So I don't do a CO2 laser anymore. I just do medium depth stuff. So the medium depth laser I use is an erbium YAG. So it's, again, a medium depth laser, like a medium depth chemical peel. That's really the same thing. The difference, though, is the post-op period. When I do a chemical peel, it's like I'm pickling a pickle. It's using acids to denature the skin. It's pickling the skin. It's not burning it off. It's not removing it. It's keeping it on the skin. When I do an erbium YAG laser, it's burning off the top layer and it's shrink wrapping the skin. It's heating up the collagen. The thing, though, is that when it takes off that top layer, that skin's going to ooze like if you skinned your knee. Okay, so the post-op period of 7 to 10 days is a little bit more intense because now it's going to ooze a little yellow crusty, and like you skinned your knee, and you're going to have to soak it and soak it. So every time it gets a little yellow crusty, you're going to take some distilled water, white vinegar, and you're going to a sponge and soak it to dissolve it off, and soak it and to soak it, and then you're going to put the Aquaphor on. The chemical peel is not going to do that. Sometimes it does, very rarely, but it doesn't do that. It doesn't do that oozy thing. So the post-op period is easier with the chemical peel than it is with the erbium YAG laser. Now, the other thing is the chemical peel, everyone's skin is different, and the chemical peel will turn the colors and it will tell me when to stop. The erbium YAG laser, or any laser for that matter, everyone's skin is different. Everyone's skin reacts differently to a laser. So I could do one setting on my skin and be perfectly fine, and I use that same setting on someone else's skin and I scar them and I burn them. So you have to, with lasers, and this is true for IPLs or broadbands, you have to start at a very, very low energy level, right? A start safe parameter, and see how their skin handles it, okay? Because it doesn't give you any indicator. It's not like it turns a color or you know. So you have to start really slow with that. And so it's kind of, again, everyone's skin is different and they handle those energies differently. So you'll have to go like, it might be not as cost effective because you have to start so slow and gradually increase the energy. You do it. How'd you do? I was fine. Everything was easy. No problem. No crust. Do it again. All right. I got a crusty scabies. Well, now I have to back off because I don't want any crust or scabs. So that's why I like the chemical peel, especially for under the eyes. Very elegant, very delicate, very safe. I don't have to worry about scarring people. Like, there's always that risk, but in 22 years, I have never scarred anyone on their eyes with either the laser or the chemical peel because it's very conservative. But very safe, very elegant, and it gives me that extra bit of information that makes me feel even better. So yes, we'll resurface people with erbium YAG lasers. We'll do those lasers for their skin, for brown spots, for wrinkles and that type of stuff. But that's just another discussion. So I think, let's see, I've not been good about answering questions tonight. Large difference in cost in aesthetic versus for a medical chemical peel. I just got to see this. Okay. So the issue is cost. So the question is cost. There's two, I look at things as two different costs. There's time cost, cost and time, and monetary cost, and downtime, right? You missed work. So then again, I told you there's a spectrum of chemical peels. It's like go from mild to strong, and there's everything in between. So if you're someone who says to me, boy, I'm taking care of my mom, and my mom would freak if I'm not there, or she would be really concerned if I came with Vaseline on my face, and I just can't do this. Well, you'd be better off doing the milder stuff, doing them in series, stacking them over time, right? Just because, or I can't miss work. There's no way I can miss work for a week. So there's that aspect of it. So when I talk to people, I'm trying to figure out what fits in their value set, what fits in their lives. On the flip side, you could have children that are going to school, and you have to get up early in the morning and you have to get them on that bus, and you've got 2 seconds worth of spare time. And then at the end of the night, you're taking care of someone and you're running around, and you don't have 2 seconds at the end of the day. Me giving you a whole bunch of creams to do, put this on, wait 15 minutes, put this on, wait 15 minutes, put this on. There's no way you're going to be compliant doing those creams in the morning and creams at night, right? So you might say, you know what? I can't do those creams. I can't do the strong stuff. But once a month, I can carve out an hour for myself, go see the medical grade esthetician, go there, relax, do the chemical peel or enzyme peel or the microneedling or microdermabrasion with the esthetician, and pamper myself and have that hour for myself. So it really depends on the person's lifestyle and what's going on at home. Some people, the creams in the morning and night works out great for them. They're compliant, they can do it. There's really no downtime. You can go hard as you want, or you can go as gentle as you want. There's people where they don't have any time, and they will take every 4 to 6 weeks, they take that hour out of their day, and they pamper themselves, and they do it, and they spend that time with Julie, the esthetician. Then there's other people who are like, I don't want to screw around with this. I want this done right now. Let's get it done, and I want something, I just want to get it done. Or their wrinkles are so deep or their brown spots are so bad where we have to use a more aggressive thing. Now, from a cost perspective, again, you have to weigh that, right? So things that are super cost effective, a sunblock, your vitamins, your retin A, your vitamin C and E, there is nothing more cost effective than that to slow down the aging process. That is your best bang for your buck by far. Doing your own skincare. Good skincare, medical grade skincare is not going to be cheap, okay? You go to a box store and you buy something off the shelf that's got salicylic acid in it. It's not the same as buying a medical grade product, right? A lot of research goes into that. The purity of it, the stabilization of it, how it penetrates your skin. There's a lot of thought and research that goes into those medical grade products, and that's why those products cost more. You buy it online, 70% of the stuff that people buy online can be counterfeit, right? So you got to be really careful about those things. So if you're going to invest in your skin, invest in a good medical grade skincare. You will not regret that. But with that, you need the education. There's nothing worse than buying a whole bunch of stuff and no one teaches you how to use it correctly. So the education, someone to teach you, a resource to talk to if you're having an issue. Oh, it's getting too red and peely. You can call on, you can sort of work through that. And so the cost for a medical grade chemical peel varies a lot. Varies region, what part of the country you're in. If you're in a big city or if you're out in the country. Depends on the strength of the chemical peel. Depends on how many areas you do. So there's a lot of variability in that. And again, you're going to have, from my standpoint, I tell people, you have to pick the person that you feel comfortable with. You're going to, the person that you feel comfortable with may not be the least, the cheapest, right? But you really get what you pay for. So that's pretty much it. And that's 8 o'clock. So thank you for joining me for this hour on All About Chemical Peels. Again, I'm Dr. Paul Stanislaw. My office is in Avon, Connecticut. We are doing these Facebook Live events on the second Thursday of the month. We had to do it today on Wednesday because my son's got a football game tomorrow night. And so I wasn't going to be able to do that. So thank you again for joining me. I don't know what our topic is for next month, but if you have any ideas for a topic, just email us and we will try to cover that topic. So thank you very much and you have a great night.